Diabetes is a chronic medical condition that affects how your body processes glucose, sugar, in your blood. Glucose is an important source of energy for your body, but if you have diabetes, your body either can't produce enough insulin, a hormone that helps regulate glucose in your blood, or can't use the insulin it produces effectively. This causes glucose to build up in your bloodstream and can lead to a range of health problems. There are three main types of diabetes. 1. Type 1 diabetes. This is an autoimmune disorder in which the immune system attacks the insulin-producing cells in the pancreas. People with type 1 diabetes need to take insulin injections or use an insulin pump to regulate their blood glucose levels. 2. Gestational diabetes. This type of diabetes occurs during pregnancy and usually goes away after the baby is born. However, women who have had gestational diabetes are at higher risk of developing type 2 diabetes later in life. 3. Type 2 diabetes. This is the most common form of diabetes and is often linked to lifestyle factors like obesity and lack of exercise. Type 2 diabetes is a chronic medical condition that affects how your body processes glucose, sugar, in your blood. In type 2 diabetes, your body becomes resistant to insulin, which means that glucose can't enter your cells as easily. This causes glucose to build up in your bloodstream, leading to high blood sugar levels and a range of health problems. Risk factors for type 2 diabetes include 1. Obesity or being overweight. 2. Lack of physical activity. 3. Family history of diabetes. 4. High blood pressure. 5. High cholesterol. 6. Polycystic ovary syndrome, PCOS. 7. Age. Risk increases after age 45. Symptoms of type 2 diabetes can be similar to those of type 1 diabetes, including 1. Frequent urination. 2. Excessive thirst. 3. Fatigue. 4. Blurred vision. 5. Slow healing of cuts or bruises. 6. Tingling or numbness in hands or feet. 7. Increased hunger. However, some people with type 2 diabetes may not have any symptoms, especially in the early stages of the condition. Diagnosis of type 2 diabetes is typically done with a blood test that measures your fasting glucose levels or your A1C, a measure of your average blood glucose levels over the past 2 to 3 months. Treatment for type 2 diabetes typically involves lifestyle changes and medication, and sometimes insulin therapy. Lifestyle changes that can help manage blood glucose levels include: lifestyle changes play a crucial role in the management of type 2 diabetes. These include healthy eating. Eating a healthy, balanced diet is crucial for managing blood glucose levels. It is important to limit sugar and refined carbohydrates, and choose foods that are high in fiber, whole grains, lean protein, and healthy fats. It is also important to eat smaller, more frequent meals throughout the day rather than a few large meals. Regular exercise. Regular exercise helps to lower blood glucose levels, improve insulin sensitivity, and reduce the risk of complications associated with diabetes. It is recommended to do at least 150 minutes of moderate-intensity aerobic exercise per week, such as brisk walking, cycling, or swimming, in addition to strength training exercises. Weight management. Maintaining a healthy weight is important for managing diabetes. Losing even a small amount of weight can improve blood glucose control, insulin sensitivity, and blood pressure. Quitting smoking. Smoking increases the risk of complications associated with diabetes. Quitting smoking can help reduce this risk. Medications commonly used for the treatment of type 2 diabetes. Metformin. This medication is usually the first-line treatment for type 2 diabetes. It works by reducing the amount of glucose produced by the liver and increasing the body's sensitivity to insulin. Sulfonylureas. This class of medications stimulates the pancreas to produce more insulin, which helps lower blood glucose levels. Examples include glipizide, glyburide, and glimepiride. DPP-4 inhibitors. These medications increase insulin secretion and lower blood glucose levels by blocking the enzyme DPP-4, which breaks down incretin hormones that stimulate insulin secretion. Examples include sitagliptin, saxagliptin, and linagliptin. GLP-1 receptor agonists. These medications increase insulin secretion, decrease glucagon secretion, and slow gastric emptying, which helps to lower blood glucose levels. Examples include exenatide, liraglutide, and dulaglutide. SGLT2 inhibitors. These medications block the reabsorption of glucose in the kidneys, leading to increased glucose excretion in the urine and lower blood glucose levels. Examples include canagliflozin, dapagliflozin, and empagliflozin. Insulin. Insulin therapy may be necessary for some people with type 2 diabetes when other medications are no longer effective in controlling blood glucose levels. Insulin can be injected using a syringe or pen, or delivered using an insulin pump. It's important to note that the specific medications prescribed for a person with type 2 diabetes will depend on their individual needs and health status, and may change over time as their condition and treatment goals evolve. It's also important to work closely with a healthcare provider to ensure that medications are used safely and effectively. Complications of type 2 diabetes can include 1. Cardiovascular disease, including heart attack and stroke. 2. Nerve damage, neuropathy. 3. Kidney damage, nephropathy. 4. Eye damage, retinopathy. 5. Foot damage, including ulcers and infections. 6. Skin conditions, including bacterial and fungal infections. 7. Hearing impairment. Please subscribe the channel. Thanks for watching.